In today's mental health check, a new study finds more young adults and teens are being prescribed antidepressants to deal with anxiety and depression.
Antidepressant prescriptions among young people aged 12 to 17 actually rose 64% since the start of the pandemic in March 2020. That's according to these findings published by the American Academy of Pediatrics. And joining us now is Dr. Yalda Safai. She's a psychiatrist and public health expert. Dr. Safai, thanks for being with us. Those numbers are startling, right? So even before the pandemic, I know there was a lot of use of antidepressants, and now we're seeing this rise. Why do you think that is?
Sure, I got to start by saying there's nothing wrong with taking antidepressants.
No.
I just want to make that clear. So we know that the mental health of our youth has been deteriorating for the past decade or so. Antidepressants are used to treat depression and anxiety, and that has been on the rise for the past decade. What happened during the pandemic was our kids were isolated at home, academic structures were broken down, they were facing with their parents losing their jobs or losing caregivers to COVID. So this already vulnerable population had this extra stress on them. So what happened during the pandemic, however, was that care got transitioned to telehealth. So people who couldn't have access to care before because they were in counties who didn't have psychiatrists or child psychiatrists all of a sudden had access. So the authors of this study are basically speculating that they don't think that the rise that you're seeing in antidepressant prescription is necessarily because of need only. They think it's because of access as well.
Okay, so increased access to mental health services.
Which is a positive.
Yes,
right.
100%.
Yeah. Not a bad thing. Interestingly, though, the study did find the rate of antidepressant use went up among girls and young women, but declined among young men. Do we know exactly why that's happening?
They don't know exactly why, but they have a few theories. In general, females during the age of puberty years are more prone to anxiety and depression to begin with. And females tend to internalize when they're under distress. So it makes them more vulnerable to anxiety and depression. Males tend to externalize. They engage in violence. They do substance abuse. And males are less likely to seek care than females. So they seem to think it's not because males were not suffering. They seem to think it was because they just weren't seeking help.
You know, we try on this show to talk about mental health a lot, to destigmatize it some, right? And as you said, there's no shame in taking medicine if you need it. So how do you start that conversation if you think you have someone in your life who might need antidepressants?
I think it's really important to share your story. If you're personally struggling with depression and anxiety, when you talk about it, it makes other people comfortable to talk about their struggles and to seek help. It's all about destigmatizing it and being vocal about how, you know what, I'm struggling. How are you feeling today?
And of course, there are non-prescription options for treating depression and anxiety. Can you walk us through some of those?
Sure. For mild to moderate cases of anxiety and depression, we always recommend therapy first and lifestyle modifications such as exercising, meditating. For severe or cases of depression, we would say go ahead and take an antidepressant.
And what are the signs? Like when does it get into that territory where you really might want to think about medication?
It's a little bit different for adolescents versus adults because in adolescents, the symptoms of depression are different. They present as irritability, not depressed mood. So for parents, it's really important if you see drastic changes in your child's behavior, if they're being more irritable than usual, you might want to think there's something wrong. In adults, it's depressed mood, low energy, lack of ability to feel pleasure, not eating, not sleeping. So it's a little bit different for the two age groups.
And, you know, I'm mindful that as kids grow up, you've said it right, kids get moody, you're going through puberty, there's so much going on. How can parents be mindful of some bigger signs of anxiety, depression? You touched on some of them, but I'm sure parents miss some of the signs too.
Yes, I would just say if there's a drastic change in your kid's behavior, investigate.
And call someone, reach out to someone. Yeah, so good. Dr. Safai, thank you so much for being with us. Really appreciate it. Important conversation.
Indeed. Thank you so much.